If you are the funny client who has to make a joke or feels the need to sort of lighten the mood after every heavy disclosure or difficult topic, again, with love and respect and so much kindness, I want to be clear that that is holding you back. Okay, hi everybody. Thanks for coming back if you've been here before, or hi, welcome if you're new. My name is Mickey. I'm a therapist, and we talk about therapy things on this channel. And today we're talking about therapy itself, because I get this question all the time, which is my therapy is not working, or I've been going to therapy and like it's not helping. So what do I do, right? How do I fix that? Is it me? How do I make it better? And I want to answer all of those questions. I want to talk about that because there are a couple of things that you can do and things that you can change to hopefully make your experience a little better and more transformative. I do want to be clear in all of these types of videos, this is broad strokes, education and learning, right? I can't therapize you. This is not therapy or a substitute for therapy. That said, I always have links in the description for free if you want to go find a therapist of your very own. So use that at your disposal. But that's it. There's a number of things that could be at play here when we talk about like why therapy is not working. So I'm just going to cover a couple of them. If you want me to cover more, let me know. Offender number one, though, is going to be a mismatched therapist. This is usually a thing that happens if, for example, your therapist wants to use like a CBT-oriented approach, whole video about CBT here, or like a somatic experiencing type of approach, and you have an issue that's incompatible with that, right? If you have chronic childhood trauma and your therapist wants to use an approach that is like solution-focused, brief therapy, that's probably not going to work. So being aware of whether or not we have a mismatch in that regard is going to be helpful. You can just ask your therapist, by the way, like what orientation they use, or if you do like your sort of standard 5-minute free consultation thing, or 15 minutes, whatever. You can just ask them, what's your orientation, right? My issues are X, Y, or Z. You know, what's your typical approach to something like that? And if that doesn't sound like it's going to work for you, then you're allowed to just not work with that therapist. If you're already working with that therapist and you know that it's not a fit, you can talk about that. You can try to find a new therapist. There's lots of things that you can do, but be aware if there's a mismatch there, because that's going to be a problem. This can also happen if you find a therapist who's just like not aligned with you personality-wise. I get this comment all the time from people being like, I wish you could be my therapist because I can't seem to find somebody who vibes with me or is like me. And I do just want to validate that. That's very common. It happens a lot. I'm hoping it happens less as there is a new generation of therapists growing up and becoming clinicians, but it is very important to find somebody who meshes with you, right? Not just like personality-wise, but also as far as your values are concerned. In this day and age, politically, please know that you're allowed to say like, hey, what's your political leanings, right? That's allowed. If your therapist refuses to answer that question, to me, that's a red flag. Listen, I'm just going to be honest. It doesn't necessarily have to be a red flag to you, but for what it's worth, especially for queer, BIPOC, other marginalized folks, it is very important that you have a therapist that isn't going to try to silver lining your oppression or marginalization. So take that for what you will. That said, it could also just be a bad therapist, right? We have lots of videos on this channel about therapist red flags and signs that your therapist sucks. So I'll put those up here as well. If your therapist is just not a good clinician, straight up, that's also going to hinder your progress, obviously. So be aware of what those signs are. I highly recommend these videos. Go watch these if you haven't already, because it's important to know if your therapist sucks or not, I think anyways. Offender number two, if your therapy is not working, if it's not helping, we might be doing surface level work. This can be the like venting thing that we do with our therapist, where we're not necessarily diving into deeper healing. We're more so just like recapping things, or we're sort of like venting and talking about our frustrations with day-to-day stuff. And also, if a therapist is not challenging you, if they're not encouraging you to like get into deeper levels of emotional processing and that stuff, you're just perpetually stuck then in this fucking cycle of like talking about your day and like, well, this week has been okay. And, this is how I feel. All right, well, we're out of time. See you next week. That's not going to help you. Like, of course, that's not going to help you. And I want to be clear. This is rarely a client's fault, I would say, if ever. More often than not, this is going to fall on the therapist's shoulders, because it's normal for clients to be like, right, I don't want to talk about the stuff that I'm afraid of or that I'm uncomfortable with, but a therapist's job is to challenge you. They should be a person who recognizes that and meets that with some compassion, and also is like, okay, but we're not here to talk about your day or your week though, right? Like, We need to talk about some deeper level stuff if you want to experience some kind of benefit. That's very normal. Obviously, they shouldn't phrase it like that, but still, they should be encouraging you to dive deeper and to challenge your resistance towards those things. The next thing I want to talk about, if your therapy is not going well, you might be lacking in goals or structure. This can be a common problem. If you're feeling kind of aimless in therapy, if you're feeling like that, I hear this all the time when they're like, well, I go to therapy and like, I don't really know what we're doing, right? Like, I don't know what we're talking about. Bad sign, not a good sign. And again, I want to be clear, this is not necessarily your fault. A therapist's job is to set goals and to create a treatment plan. By the way, you're allowed to ask about your treatment plan. It is totally okay for you to say like, hey, can we look at my treatment plan? Can we double check, like, what are my goals? Like, what are we meant to be doing here? It doesn't necessarily have to be like a spreadsheet therapy either, right? You don't necessarily have to be like, you can also just be clear with your therapist. Like, hey, I looked at my treatment plan, or like you can do this together and say, I really want to focus in on this thing that matters to me, right? I want to feel better in this regard, or I want to improve my ability to do X, Y, or Z. And even though we're going to create some space, obviously, to process like, I had a really shitty week, or like this one thing happened to me, or I, had this pain point show up in like a friendship or I don't know, work or school or whatever, and we're making space for that, we are still ultimately at the end of the day also doing some work to work on those other like greater issues. The other thing about this that can be helpful, I don't know if there's any new therapists or therapists watching this, but for what it's worth, if you are a clinician, I find it helpful to try to find some commonality between the stuff that folks are going through like weekly, daily, just sort of like, the venting that folks will want to do at the beginning of session. I try to find some commonality between that and the greater goal that we're working on, right? To kind of tie those things together and help to create some fluidity through the session, because it can feel a little uncomfortable to be like, great, let's talk about your childhood trauma, right? But even if you're a client, actually trying to find some commonality between like, actually, I had a really bad week because I got in a fight with my friend, and now that I think about it some more, maybe that's related to the fact that I feel very uncomfortable with setting boundaries, right? I'm a people pleaser. And so, of course, I got in a fight with my friend because I secretly resent them. But that's because I don't know how to assert myself. And I feel very nervous about doing that. Those things are usually tied together. And so that kind of through line can help to make the venting and the chit chat at the beginning of session not feel quite so aimless and like, not that it's useless. It's never useless to process your emotions, but you know what I'm saying? It's very important that we just have an overall direction in therapy, because otherwise you're going to feel like you're just kind of talking to someone and doing nothing. And that's not the point, especially if you're spending a lot of money, right? Therapy is not an accessible resource for everyone, and you shouldn't feel like your time is being wasted. That's not fair to you. Now, listen, I am the first person to throw the book at therapists for doing the wrong thing, not being good therapists, sort of, dropping the ball. And sometimes clients will struggle with feeling fear or shame around the stuff that we need to work on. And so there can be these like internal things that are holding us back, right? It might be just like straight up resistance to change and that we're uncomfortable with that. Oftentimes it has a lot more to do with fear and like difficulty with really diving into that vulnerability. Also with love, if you are the funny client who has to make a joke or feels the need to sort of lighten the mood after every heavy disclosure or difficult topic, again, with love and respect and so much kindness, I want to be clear that that is holding you back, right? When we're the person who cannot process an emotion without making a joke out of it or without leaning into our sense of humor, that can be a reason that we're struggling to make progress or, again, move deeper into that emotional processing, because while it's very uncomfortable, of course it makes sense for you to be afraid of that, it is still important for us to get comfortable with talking about that, with moving through that, and ultimately to challenge the impulse that we're going to have internally. For what it's worth, also, if you notice yourself doing this, you could say that to your therapist, right? I'm a big fan of just saying stuff out loud, especially if you notice that like maybe I'm being secretive because I am like projecting some of my like, I wish that my mother loved me onto my therapist and I want my therapist to like me. So I'm not telling her about the fucked up shit that I'm doing or the embarrassing things that I said, right? Say that out loud. Just tell your therapist that. That's okay. We're equipped to deal with that. We should be. Anyways, a good therapist should be. And that, like externalizing that can actually be really helpful in moving the stuff forward. And so I want to encourage clients to remember it's not your job to know how to fix it. That's why you're in therapy, right? So you can just say out loud, you know what I'm realizing? Every time that I think about or want to talk about something, I lean away from it or I shrink away and I'm afraid. I don't know how to do that. Great. Like a good therapist should be able to pick up that ball and be like, awesome, let's run with this, right? Let's talk about that, process that, whatever, do the therapy things. Oh, also, for what it's worth, this tendency is very common for people who have struggled with like self-destructive patterns in the past, especially common for people who are parents. If you have processed some of your own trauma, right, people who have wounded you, and it's now time for you to talk about the way that you've wounded others or the way that you've participated in your own dysfunction, it's very normal to feel a shame around that, and that can be a reason that we shrink away also. Again, same advice. I want to encourage you to just voice that out loud and tell your therapist, I'm struggling with XYZ because of ABC. Okay, the last reason that I want to talk about people struggling with therapy or therapy not working is systemic issues. I know that y'all didn't think you were going to get out of a video with me without a soapbox on this issue. And so it's very important that we acknowledge issues like insurance stuff, insurance fuckery, right? A lack of access to specialized care or a lack of access to care at all. Burnout with like mental health professionals and therapists and things like that. And also environmental stuff, right? All of these can add up to a picture of a lack of access and systemic issues that are going to make it much more difficult for therapy to actually be effective for you, right? If your insurance is regularly returning your stuff and saying that you have to pay more for your sessions than you had planned on, right? Or if specialized care or care at all are so expensive that you can't really afford them easily or afford them consistently, right? Consistent attendance is very important in therapy. But if there are outside forces making it much more difficult for you to do that, then of course that's going to make therapy more difficult. So I also want to be clear that the environment that we exist within obviously impacts our mental health and our ability to show up, our ability to be present in therapy. It's very, very, very important that we acknowledge how much that plays a part in our healing journey. And especially the therapy world loves to do this where like we'll label clients as non-compliant because they have inconsistent attendance, right? And like maybe that's because they don't have access to transportation. Maybe that's because they can't afford their sessions. Maybe that's because they, I don't know, are neurodivergent and fucking forget stuff all the time, right? A lot of this is stuff that's outside of our realm of control. And so not acknowledging that and just saying like, I don't know, it's not working is not good enough, in my opinion. I also think the impact of things like marginalization, of systemic oppression, right? Capitalism especially is going to fucking do a number on our ability to show up, right? Therapy, especially like old therapy, loves to do the thing where we silver lining people's bullshit and we say like, well, if we just like slap some CBT on this like systemic oppression, then it's probably fine. And like, no, actually it's not. It is very compelling, I guess, to observe the way that when a systemic stressor is removed from a person's life, how much easier they're able to flourish and improve. And so be aware of that. If you're noticing that you're struggling, if you're feeling like therapy's not fucking working, and you're aware that you have all of these systemic issues, talk to your therapist about it. It's not realistic for a therapist to say like, let me just remove these systemic issues for you. Obviously, that's not a thing. And you would be surprised, actually, how much having space to process that and to talk about that can impact your ability to deal with those things. While we can't, again, like remove those systemic issues from your life, we can very much make space to talk about them and also set some level and more realistic expectations, right? In especially chronic or long-term trauma, in long-term healing, we might need to dial back what is actually a realistic goal. And especially to set some realistic expectations about like, okay, so while we would hope that we can, I don't know, assess some self-destructive patterns in your relationships, the way that you engage with your friends, family, loved ones, right? Maybe that's not realistic right now because you're early in your sobriety journey, because you don't have a lot of money, because you have inconsistent access to therapy, either by means of inconsistent access to the internet or inconsistent transportation. So while that might be a realistic goal, maybe right now what we should focus in on is creating some toolbox type of stuff for you to realistically work through your emotional distress in the moment, right? Maybe we need to dial back. We'll talk about emotional or self-destructive patterns in your relationships later, once we have some more foundational pieces in place, right? So we're going to talk about some things that you can use outside of therapy so that even if you only attend one session of therapy this month, I hopefully have provided you with some things that you can practice and utilize on your own and grow those skills outside of therapy so that when you come back, you'll have a whole bunch of data about what worked well, what didn't work, what was like a maybe, but you're not really sure if you used it right, and then we can go from there, right? Obviously, not all therapists are going to be game to do this, and I recognize that. I get that comment all the time too. But practice self-advocacy. I think that's going to be a key takeaway from this as well, is that all of these things, regardless of what is creating a challenge for you, what's making therapy maybe not so successful for you, self-advocacy is going to be a key piece of turning that around, whether it's because of yourself or it's because of a shitty therapist or it's because of systemic and outside issues. Advocating for yourself and saying, hey, this is a thing. This is causing a problem for me and I need something to change, right? I need something to make this different or to make this better. That's very okay. And you're allowed to say that. I know that I say that all the time on this channel. Maybe not so much recently. Let me be clear. You're allowed to say those things because therapy is a service, right? You're hiring a professional to provide you with their expertise. And so in therapy, you're the boss. You're the person who gets to say, I'm paying for this thing, right? Or maybe my insurance or, my, benefits or something is paying for this thing. And so you work for me. You need to do the things that I'm asking you to do. That's very loud. Obviously, we would want to say that nicer, but you get the point that I'm making. And especially to reflect on your stuff that you bring to the table as well, right? Advocate for yourself and do some reflecting about, are there things maybe that I'm afraid of or that I'm not doing? And hopefully in doing those things, we can have this sort of lovely collaborative environment where we're then creating this that's backwards, but forward momentum to kind of jumpstart the thing and experience some better progress. If after all of that you don't experience any better progress, please God, try a different therapist, try a different clinic, try a different modality, try something besides this, and also consider that maybe individual therapy is not great right now, right? Group therapy, couples therapy, support groups, all of that can also be a helpful resource as well. So if you found this useful, if you like this video, let me know. Like the video, obviously. That would be nice. But you can also stay. You can subscribe. We do stuff like this and a nice pop culture moment that I'd love to have you stay for. So thanks for being here. Don't forget to subscribe and do all the things. And then you can share the video to help the channel grow and to help each other grow. And I'll see you next Saturday. Okay, bye.